So yesterday, we heard the leader for the majority in Parliament speak on why Zipline should be cancelled, the contract should be cancelled. He did mention that in previous times, what it was supposed to be used for, that is transporting of blood, has actually changed into transporting of condoms and books. Well, he's also admonishing the fact that when we look at what Ministry of Health is supposed to do, they are not doing it. What they have to do is to try and raise their own money to buy their own drones to deliver blood to these areas. Not just that, he also thinks that the amount of money that we use in giving to Zipline, let me put it like that, the amount of money that we use to operate, good, that's the word I was looking for, operate in the delivery is $170 million US, which can be used to even fix our roads, and we can transport the blood to these villages. Let's hear what he had to say in Parliament.
He said government is engaging the company on the way forward as it pushes to secure value for money.
Apart from that, their services was to concentrate on the hard-to-reach areas and emergency services. But upon review of the activities, what we have realized is that the hard-to-reach areas constitute only 12% of the activities, 12%, 1-2. And emergency services is 4% of the activities. And it will interest you to know some of the items they fly. Items like condom, blood donor cards, not blood donor cards, mosquito nets, food and nutrition items, adhesive tapes, syringes and needles, education materials, among other things, textbooks, exercise books, uniforms, and a lot more. So these are some of the items they have been flying. And so when we came to office, we think that there must be value for money. And therefore, we are engaging them. So if you hear that we are not engaging Zipline, it's not true. We have met more than 3 times, and we are still engaging them to know how we can have value for money. And that is what His Excellency the President has directed us to do.
Kwame Owiredu said, although the former health minister said...
And this is what the health minister said. Also, we have the majority leader in Parliament who also said that looking at the amount of money that is actually spent is a bit too much. He did say that we are spending 170 million Ghana cedis annually on Zipline, and he doesn't think that is right for us to do that. He thinks that if Ministry of Health were to have purchased their own drones, it would have been better. Now, the price of drone that he quoted is about $4,000 US to $10,000 US. So why don't we purchase our own and just do the delivery? If not, we can also just use the money to fix the roads and go ahead to transport it via road to these villages. Now, the question we are asking this morning is that, do you think that the minister and the majority leader in Parliament is in the right to go ahead and cancel this particular contract between Ghana and Zipline? Or you think Zipline is doing something right and we should continue doing this? This morning, we have been joined by the PRO for Ministry of Health, and that is Tony Goodman, and he's joining us. So good morning, Tony.
Good morning.
How are you today?
I'm blessed, you.
Great, and we are also doing fantastic this morning. Now, we chanced on the story, and for us in the studio and everybody watching us this morning, we want to get to understand why the minister and the majority leader in Parliament is calling for the cancellation of the contract between Ghana and Zipline.
Thank you. Good morning to our viewers and listeners. This Tony Goodman is no more the public relations officer. There is a public relations officer for the Ministry of Health.
Okay.
But I try to speak for the Ministry of Health, also I'm the head of health training institutions. So it's clear that the Zipline contract, it's not actually a value for money for the people of this country. The purpose for introducing Zipline has actually not been met. One, we're told that the contract was going to be free to the people of this country. But as we speak, we are paying about $88,000 per center. We have paid close to $2 million for the contract. And what they are currently doing, which is transporting essential medicine, is no more their core mandate, but they transport everything, including exams papers, condoms, and the rest. And when you calculate the essential medicine, they move from one location to the other. It's just about 1%, even though it's also contributing to healthcare delivery. We think that there is no value for money in this venture. And if we are able to put in proper measure, we can save the country a lot of money.
Okay, thank you.
We in Ghana have a proper road network. We have proper commodity distribution, far before we got Zipline in country. So that is the reason why we are where we are.
Right. Now, Mr. Goodman, you did mention that they've been transporting condoms. Are they transporting these condoms to the villages like they were supposed to transport blood to the villages?
Yes. When you look at their distribution schedule, these are some of the things we have on the schedule, apart from the essential medicine. The reason why we keep mentioning these is because it's not part of their core mandate, and they've been found on their distribution list. That's why we keep mentioning them. So which means that the number of items they transport, or the items that are transported to these areas, are not entirely special medicine. Yes, so yes, they transport them to across the country, wherever their destinations are. These items go there.
Now,
You remember recently
yes,
that the WAYEC boss thanked Zipline for transporting exam papers to some of the areas for them. It was in the media. So these are some of the things. We thought that if you can have a proper transportation system for all these items, we should not be spending the huge money. If you look at the amount of money we are spending, we could be buying air ambulances for the country. So we're only looking at what we are doing and what can we do best. So we are still having negotiation with them. It's not as though the contract has been cancelled. We are still on the table, and these are some of the things that are coming up.
Okay, that's fantastic. Now, looking at what they were supposed to have done initially, which is to transport blood and essential medicines, not with the other things, the condoms and those things, what they were doing and the amount of money that we were paying, was it worth it?
That is why I say we are not getting value for money in this whole thing. If they are transporting blood, essential medicine, they are just 1%. You know, in some of the areas, it will be difficult for you to transport blood and it to be matched. You need to have the specialist on the ground to do some of those things. And we don't have that. So it is not worth it when it comes to what we are doing and how much we are paying. If we could find a different way of doing it, we could save the country a lot of money.
If you say a different way, which different way are we looking at?
Well, you know, we've had commodities distribution in Ghana for a very long time. That is why we have the central medical stores, we have the regional medical stores, we have the districts. So you could have a way of decentralizing that process better so that the commodities are closer to the facility, so the medicines are closer to the facility. You have a proper blood bank dotted across the country. You can have or have proper refrigerator for blood storage. You could save a lot of money. You could use some of this money to even procure a lot of blood refrigerator across the country. And then because we are doing that, you know that you need to also provide the specialists to be around these areas to work. But if you provide only the drones, and the drones get there, and it's not able to have people, or you don't have people to actually work on them. Some of them are upon request, where you have specialists, the essential commodity is actually transported to that person. So we need to just look at our healthcare system is different from what we have in any other African country. Thankfully, we have a system that is well networked, a robust one. We only need to oil it well, and then we'll have a perfect system. What is happening in Rwanda and other countries where blood are transported by Zipline and other things, that cannot happen in other parts of Ghana.
Okay. Now, the majority leader in Parliament, Honorable Owiredu, did mention that we should go ahead and purchase, or Ministry of Health should go ahead and purchase their own drones. But from what you're saying, it's best to rather build these centers in those areas than to buy the drones. Is that what I'm getting?
The multiple approach would work. If you are having the drone centers for yourself, and if you also have the decentralized system, that could also work. So you look at which approach best fits what we have in Ghana. Would it be the decentralized one? Because we have up to CHIPS compound. That is why we are introducing the free primary health care. So if you are introducing free primary health care and there are personnel on the ground, what do you add on to what they are already doing? So these are some of the things we need to look at. Do you have to have the drones closer to them? What system do we have? But to just bring drone and just sink into a system that did not contemplate the introduction of drone, then it means that you are just, it may be nice, it may be fanciful, but are they really doing? Yes, they may be doing some percentage of work, but is that what we want? Will they continue when the system really accepts what we are doing? The percentage of money we are spending, is it worth it?
Right.
When we introduced the Bangladesh system, which is the CHIPS compound, it's currently working. So without the CHIPS, we would have been sending drones to the various communities to go and deliver work. So we have the personnel, we have a system, we have the regional hospital, we have district hospitals, we have health centers, we have CHIPS compounds, and the rest. Can't we work through these systems we've created over the years? We've tested them, they are foolproof, and why not use them? So all these things are currently on the table, and we are looking at discussing. Because if you are saying we need to finance our health, we are looking at more money into healthcare system. This one, would it actually add on, or we should rather strengthen our system?
Right. Okay, Mr. Goodman, thank you so much for joining us this morning. We are very grateful.
My pleasure, my sister.
All right, have a good one. I'm back in the studio. My guests are here and they are poised for the conversation. Of course, let me start this with Kwame Owiredu because he kept on jotting down some points.
Yes,
and yes.
I think to some extent, and actually to a large extent, I sort of disagree with most of the things he has said. Because if you are telling us that probably we need to look at, transporting them by road and all that, we know the problems with our road. There have been several instances where blood has delayed and it has resulted in deaths of so many people. So I don't think even there is a need to have a look at the Zipline contract again, we should bring in the idea of going back to having blood transported by road. We know the situation and the state of our road, so I don't think that would be a formidable solution. Then it looks as if the bit about using it to transport condoms are being downplayed. But I think condoms are as essential as blood because there's a running story that there is a hike in HIV amongst young people. So I don't think we should have the conversation that using it for sex service is not important.
But condoms are not emergencies.
No, condoms are not emergencies, but in situations where people cannot be reached with condoms, with using the road and the normal means of transportation, having that additional responsibility to the Zipline, it doesn't hurt. So if there's a need to really reevaluate the contract, probably look at its usefulness again, we should do that. But when we bring in these trivial matters, it makes it look as if we don't value the running story of increase in HIV infection among our young people.
I think that if we look at what the reason for the contract between Ghana and Zipline, it's more of an emergency service than anything else. And so when we hear things like condoms, as much as it's an essential, it's not an emergency.
No, it is not as if they've stopped their core mandate. It's an additional service they are providing.
Right, but they are saying the core mandate has reduced to like a 1%. That's where the issue is.
Then does it mean that doctors in the surgical wards are no longer in need of emergency blood? That's a question. So we should ask the questions from this angle, that do we have enough blood banks in our various district hospitals, regional hospitals, such that the emergency aspect of blood transportation is no longer a necessity? If we do that, then we can peruse and interrogate the issue very well. So the people we should be speaking to are the medical doctors on the ground, are the theater nurses. Is it true that in these days there's no need for getting Zipline to bring you blood because there's enough storage, you have enough? Because one of the issues was storage facilities. Most of the facilities never had storage facilities for vaccines, for blood and all that. So we need to go speak to the people on the ground, not to the people in Accra here, that somebody in Achimkusiv, somebody in Ochumbewiate, when the doctors are on the patients, the availability of blood, what is the situation on the ground? But if we just say that it is just 1%, there should be a reason for that. Let's interrogate it, asking the people on the ground that, is it true that in your storages at your various facilities, you have the needed blood for all the surgeries? Is it true that Zipline services are no longer needed? Or just political rhetoric? You know, it happens. So we need to further interrogate it rather than just listening to the politician.
Now, I'll ask you this one, because Honorable Owiredu actually in Parliament did say that we should use the money to fix some of the roads. Ministry of Health should also buy their own drones, because if you look at the cost of drone, it's a bit cheaper. And we are spending 170 million Ghana cedis on Zipline alone.
Sure.
So why don't we just buy it and own it rather than giving this money to them?
If you'd ask me, I think it's a good approach, but it should be very gradual, because you would realize that even if we build our roads, sometimes these emergency centers, the distance to the hospitals, it is not as if they are very close. So you could have somebody in probably, let's say, Budia, somewhere in the eastern region, who needs some sort of vaccine or blood from Kolebu. It's quite a distance. So even if you fix the roads and the roads are in good shape, you still need these emergency services. Okay. If we have the infrastructure, if we have the money to procure our own drones, all the best, because then we don't spend much money in sort of these contracts. But we should not downplay the role of the Zipline people, and more so, we should not make it look like the additional responsibility of transporting WAEC documents. You know, those days when we were writing SSE, we were in school in Accra here, we're fortunate. We will finish writing, let's say, physics, and you hear that your colleagues somewhere over the seas in our front planes are still waiting for their papers. It happens a lot. Even with BEC, people around the northern parts of Ghana, sometimes their papers delay as long as 2 days, 3 days. They've not written it. And if the Zipline are stepping in and providing such services, we shouldn't trivialize it, because these are real issues facing us as developing countries.
Right. Dr. Bukari, do you think we should go ahead and purchase our own drones?
Well, this is what I will say. When a contract begins to serve its core mandate, questions ought to be raised about that. Because, look, the transportation of condoms may be important, but you ask yourself, was that the major reason why that contract was initiated or that project was initiated? I don't think so. The transportation of several other things, which maybe are important to our lives, would have been, relevant on the back of the project. But were they the main reasons? No. In my candid opinion, the issue of blood transportation, which was very major to the contract, was because we needed to pragmatically ensure that nobody, or even limit the extent to which people lose their lives for want of blood in all or many parts of this country. And so for me, that is a critical, very essential service that ought to be delivered. Mm-hmm. If the prognosis at this point is that the project is not living up to expectation and people are raising concerns about that, I think those cannot be considered to be trivial. They cannot. That's number one. Number two, now, if you look at the suggestions that are coming up, nobody, from what I heard from the ministry, no one has of this point given indication that the contract should be abolished. I think the indication is that there's a need to reevaluate the contract. There's a need to reevaluate the contract. That evaluation process can lead to the abrogation of the contract, but that's not the main point at that stage.
Beyond that, Owiredu actually did say that the contract should be abolished.
So suggestions have come up.
Yes.
But authoritatively, who spoke about this project was the Minister of Health.
Right.
Now, but suggestions from other quarters, including those remarks made by Honorable Owiredu, are just part of the conversation. Okay. Now, which suggestions also should be welcome? Now, because the reason is this, we want to get the most value for money in every single project that we invest the public funds into this country. We want to get that.
When this contract was signed, this contract was signed somewhere in 2022. Now, the question here is that when the contract was signed, did it actually deliver?
It did. I mean...
So listen, but there's an examination of the facts. And you and I, including my colleague, heard the minister on the major items that were now being transported, which is clearly a deviation from the major reasons for which the contract was initiated, isn't it? Now, we are even raising other questions of whether or not there's even value for money for the project. Whether or not, because the other items that are coming up may raise value for money issues, whether or not even it was well thought through in terms of, okay, could this be done better? And we just heard the Honorable Owiredu said, if the government were buying its own drones and giving it to teaching hospitals and regional hospitals, who would then transport blood to maybe district hospitals and other CHIPS compounds in the districts, could that have been a better use of the money? So could that have reduced the cost of the contract? Right. What are the challenges? And I like the fact that he raises concerns around whether or not we have the right professionals or that we should be speaking to the right authority.
For us, again, and this is real, whether we like it or not, this is real. When we get to the government sector, our behavior towards work is different. Okay. When we get to the private sector, our behavior towards work is different. Now, we want to make it a government thing. How sustainable is this? Looking at how the government sector is run versus how the private sector is run.
Look, I think that, and that's my very candid opinion, there are state-owned agencies that are performing. The vast majority may not be, but there are still some state agencies that are doing very well. And by this, I mean several departments of within the government structures that are doing exceedingly well. I think it
what's the percentage of these state agencies that are working versus those that are, we know how the mentality is, Honorable, just saying.
The mentality is there, but they are also private. Look, most of the challenges that we have with public sector. Do you know the persons who are implementing the projects within the public sector? Many of our projects in the public sector are implemented by private entities.
Exactly. So why don't we keep Zipline?
By private entities. And yet,
yes,
those same private entities are the ones who are making the government agencies not look like we are not performing. Look like we are not performing. Do you understand the point? So the point I'm raising is this. If you have the right kind of leadership and mentality within a state agency and the project is well conceived and the right accountability processes are integrated into the project, nothing stops a government agency from delivering a project more efficiently.
Okay.
Nothing, even at least cost.
All right. Thank you very much, Dr. Bukari. He says that government agencies can do it. So, well, we've seen some succeed and we have seen some fail, but maybe this will succeed. So you never know.